This isn't a self-help show. It's a soul remembering. I'm Cynthia Sharpe, educator, trauma-informed practitioner, proud mom to a son with Down syndrome, and vice president of Additional Needs Incorporated. I created Down to Heal because too many of us are told to survive and never taught how to heal. This is where we change that. Every other week, I sit down with parents, practitioners, neurodivergent voices, and body-based wisdom keepers. We talk about what really heals: nervous system regulation, somatic truth, community care, and the stuff you don't hear in the mainstream. Because healing isn't talked down, it's shared, it's messy, it's sacred. If you've lived it, studied it, questioned it, or been broken by it, this is the space for you. Down to Heal is a space I wish I had, honest, whole, and held. We're not here to fix. We're here to feel, reflect, and rise together. Listen on Spotify or YouTube. Let's get down to heal. This episode feels both deeply personal and profoundly important for me. When my son was a baby and had to face open heart surgery, our whole world shifted. In that fragile season, there was one doctor who guided us in both knowledge and such deep compassion, Dr. Lowell. He wasn't just a pediatric cardiologist to us. He truly became a lifeline, carrying us through a time when everything felt so uncertain. That's why having him here today means so much. We're going to walk through the very questions parents find themselves asking when they first hear the words congenital heart defect. What does this really mean? How do we prepare? What can we expect before, during, and even after surgery? This isn't just a medical conversation. It is also emotional, practical, and deeply human. Dr. Lowell is going to share not only about the medical side of surgery and recovery, also about the resilience of children, the strength of families, and the hope that carries us forward. It is a privilege to sit here and introduce part one of this powerful dialogue with someone who profoundly shaped my journey as a mom, Dr. Lowell. Welcome to Down to Heal.
Thank you.
Dr. Lowell, you were just a guiding star in our lives, and I am grateful for extending the invitation and you accepting. You know, my passion is to assist the additional needs community.
Correct.
And to expedite time. And you were there when we were the most vulnerable.
No, I'm glad.
And you were so compassionate, and I would like for you to introduce yourself and let everyone know who you are, and we'll go from there.
Okay. My name is Robert Lowell. I go as Bobby. Robert when I'm in trouble. And I'm a pediatric and fetal cardiologist. I graduated med school in 1986. I finished my pediatric residency, which was 3 years in 1989. And then I went to New York, the Albert Einstein School of Medicine, and finished my pediatric cardiology, which was 3 more years. So that was about 92. And then I settled down in Southeast Florida. My parents were there. I had grown up in Puerto Rico, so the fact that I was bilingual helped me tremendously to develop a practice down there. And then starting 2004, I guess I needed a little more excitement. I started coming to the West Coast, and I opened a practice in close to Coconut Point in Bonita Beach, in Bonita Springs, I think. Yeah. And it grew tremendously. This was a hidden gem, actually. There was nobody here. There was somebody in Fort Myers, but in the area I settled, there was nobody, and within 3 months I was totally booked. So I love what I do. I'm now retired from my full time practice. I still dabble here and there in cardiology, but I love what I do. I really do.
And we are grateful because how we came to know you was through our pediatrician
Mhm.
diagnosing Jack as his heart had changed
Mhm.
a week and a day after delivery.
Yeah.
And literally going to the appointment at 4 o'clock on a Friday.
Yeah.
And she stopped us and said, you need to go see the pediatric cardiologist. And now I'm
Right.
making the phone call. So our lives literally turned upside down
Mhm.
in a matter of moments.
Right. Right.
And then we got to meet you.
Yeah.
A godsend.
I remember I was packing up to drive back on Alligator Alley, and I got the call, and I was like, okay, this is probably nothing. It'll take me 10 minutes.
And it took a long time.
Yes, it did. Yes, it
So
did.
you noticed he had brush field spots,
Mhm.
and you did confirm that he would need open heart.
Yes. Yeah. Yeah. No, as soon as I saw him,
Mm-hmm.
I kind of realized that there was going to be a problem because he had the particular features of trisomy 21, and about 50%, almost 60% of children with trisomy 21 will have some form of heart disease from the minimal to the severe. And I knew it would take more than 10 minutes once I saw Jack.
So, right, one of the things that you mentioned to me when we arrived was, did you have prenatal care? And I
Mhm.
was shocked. I didn't know how to process that.
Yeah.
So tell me what those who are expecting
Mhm.
should look for, because I know we thought, especially me doing all the research that I was doing during that time where the
Mhm.
internet was just starting to
Beginning.
come
Yeah.
out, right? The NT, forgive me, I can't, something tube,
Nuchal translucency.
thank
The
you,
NT.
is something that they look for.
Yes. Yeah, you know what what has really advanced fetal care is the quality of the imaging. I mean, you have to realize a fetus's heart is this big.
Teeny tiny.
And before, when the resolution of the ultrasound machines was not great, everything was a fuzz. I mean, I have photographs of my oldest, who's now 42, and I couldn't make heads or tails of what that ultrasound image was. But now the detail you can see, you can even see coronary arteries, which are minuscule. So the OBGYN has the ability to see a lot of the fetal structures. But different than the OBGYN, I have the luxury of just having to look at the heart. You know, the OBGYN or the perinatologist has to, count fingers, toes, palate, eyes, ear, everything. So they can't really spend the time I spend looking at the heart. So there are several indications to look at a fetus's heart. One of them is maternal age. You know, women are like athletes after 35. They're considered, mature.
Geriatric is what we were told.
Exactly.
That lovely
A
term.
lovely term. What I would give to be 35. But anyway.
Right?
So that's a big indication, because that right there is a risk for trouble. Then there's others: diabetes, a family history of heart disease, of congenital heart disease, not so much coronary heart disease, which is an adult thing. Infections, tons of stuff, medications. So the recommendations for looking directly at the heart are many, and the obstetrician or the perinatologist takes that into consideration and then sends them to us.
Are there things that can be done prenatally to assist in helping the baby, because the heart is developing at week 3?
Yes. Mm-hmm. Yeah, there is now there's several programs. In fact, All Children's in Tampa is doing it as well. But for many years, Boston Children was the only place that was doing fetal intervention. And they are not for everything, but in particular, if you see that a valve of the heart is not developing well, particularly the aortic or the pulmonary valve, they actually can go in through the belly of the mom, put a catheter in it, and stretch that valve out. And that prevents developing a very severe congenital heart disease called hypoplastic left heart syndrome. So, so yeah, there are things that can be done, but in a small number of babies.
Okay, so ours happened to be the AVSD
Yes.
and a secondary atrial septal defect. So it's the atrial ventricular septal defect. Is that typical of Down syndrome?
Yes.
And autism, or is it strictly Down syndrome?
I'm with autism. There's things that can impact the neurological development of the fetus when the heart is not normal. If the defect that the fetus brings alters brain flow, cerebral flow, that has been shown to be a either ADHD or autism or neurological development issues, and that is not, if you add that risk to cardiopulmonary bypass and anesthesia, then the risk increases a bit. But yeah, I think the most important aspect or the benefit that fetal cardiology brings to the table is that once you know what the baby brings, you're prepared for it. And you can deliver in a center where they're ready for the baby, and you don't find out a week later when the baby crashes and the organs are sick, the liver, the lungs. So that's the biggest benefit. And if there's nothing, the benefit of peace of mind is huge as well. So the best environment for a baby, even in the worst case of heart disease, is the mom's womb. So you try to keep them there as long as possible.
So if we could go back in time, in Doug's and my situation of having Jack, if we had been in a prenatal and had known,
yes,
what would have been different?
The shock would have been earlier.
Right? Okay.
By the time Jack was born, you would have been able to process the 5 stages of acceptance. And you would have probably delivered in a place that was ready for any issues that would come up. In Jack's case, his type of defect doesn't start giving him problems until 2 or 3 months of age. So babies, like you saw, he was doing fine. He was probably gaining weight. He was, and it wasn't until the doctor heard a murmur, I believe, right, or had some suspicion that we were aware. But I think, if I don't recall wrong, it wasn't immediately that we sent Jack for surgery. We probably waited a little bit and got things arranged. And then at Nicholas Children's, he was back then, I think it was still called Miami Children's. They were able to take care of his defect.
I remember you telling us the likelihood will be 1 to 2 months. We really want him to be 5 months and 10 pounds, so that his heart is fully developed. And man, working with our pediatrician, and my milk breastfeeding just was canceled. Like everything was just like I have nothing to give. I was so stressed, and so we had to do formula, and it was literally making sure that we were measuring the formula to make sure he was getting enough nutrition, and his heart was beating so much. Can you explain how that is, that the heart would consume so much energy that it would take from the nutrition, and it I don't know where I'm going here, but maybe you can explain it.
You're going to something that's very common in kids that have significant heart disease, especially the type of heart disease that floods the lungs with extra blood. The lungs are like sponges. A dry sponge doesn't weigh much. A wet sponge is a lot heavier. So when you have a defect where the blood in the heart, instead of leaving and going to the body to provide nutrition, just recirculates back into the lungs like an AV septal defect, the lungs become very heavy and very stiff. So the work of breathing is big. it's as if they're jogging around a track all day long. So the calories that the child consumes, instead of going to putting on weight, go on to do the cardiovascular exercise that it is, just breathing and trying to move those stiff and heavy lungs. So that's a very common finding, and many times you have to go to what they call an NG tube. Just put the tube down so that he doesn't even have to suck, because sucking is a huge calorie consumer as well when the babies are young.
And that was something that we were told, that he had lost some weight.
Yeah.
And they were ready to go ahead and do that. And I wasn't ready because I had been in medical sales and knew my medical sales was more with the elderly. So I saw the trauma that being in the hospital would provide, right?
Yeah.
And an NG tube is rather invasive.
Sure.
And I thought to myself, and forgive me, I just don't want to be in the hospital one more time. This is enough stress for a baby. It's enough stress for me.
Sure.
If I can.
And the baby senses when the parents are stressed. Absolutely.
Right. And this whole process was. So we did complementary medicine, and you got to witness that. What were your thoughts on that?
Listen, even though I'm trained in Western classic medicine, but I've seen acupuncture work. I've seen herbs work. Whatever works. I think you can't approach medicine with a stiff way of looking at things. If it works for the patient, that's even better. So.
Have you seen in your practice where both the Western, the traditional, and the Eastern come together and the child like thrives far more? Would you recommend that now?
Or? I would recommend it. I don't have a tremendous amount of experience with it, because in addition, most of my practice has been, for the most part, outpatient. I haven't really been a hospital physician, which for work-life balance works very nicely, because if something gets complicated, you send them to the hospital and they have the hospital doctors there to take care of it. But yeah, I've seen acupuncture work with pain, with anxiety. I've seen herbs work for immune issues. So yeah, I'm open to anything that works. And many times, even if it's a placebo, if mentally you feel it's helping, there's no harm in that either. So I think the more tools you have in your toolbox, the better the project ends up looking like.
You suggested for us, we were on, I believe he was on 3 different medications at that time that you had prescribed, and we ended up taking him off of one because it just kept on upsetting his stomach.
Okay.
And one of the protocols you said, and I love this, was have Doug or one of you do the measuring and the other one check.
Yes.
That was.
It is, because in particular, us adults, there's a pill, you take it and that's it. But with children, most medications are weight based. So if the child weighs very little, the amounts are very small. So 0.1 ml, many times people think, oh, it's 1 ml, and 1 ml is 10 times the dose. So it's very important to make sure that the child is getting what they get, because probably one of the medications was something called digoxin, and digoxin can be pretty toxic if it's given in an amount that's not appropriate. So yeah, you swallow your pride, and depending on the couple, if the dad that wants to do the measuring and the mom confirming, which I think usually works best.
That's exactly how we did it.
Well, that is super important, because the quantities are so little, so it is important. And these all medications are poisons. So you might you want to make sure that the amount you're taking is the correct one.
I know that we personally had an incident where that situation arose where it was a mismeasurement. time exhaustion, caregiving during that time.
Absolutely.
Like, we could get into like post-traumatic stress.
Mm-hmm.
I never recognized that I was in PTSD preparing for heart surgery.
Absolutely.
Can you talk about that? What you've noticed in your practice?
Oh, well, one of the main things, the children, even though they're little, they suffer emotionally. You know, a child that was already crawling may go back to not crawling again. A child that was starting to speak may regress and not talk. So the even if nothing's happening, just the environment of an intensive care unit with all the lights, with all the bells, with all the medications being given, the day-to-day ups and downs. One of the things I always told the parents was try and not look at progress on a daily basis. Try and look at progress on a weekly basis, because the child might wake up looking fine and then blood pressure drops, or, you know, he develops an arrhythmia, or the sutures, whatever. Day to day, it's a roller coaster, and it's I mean, it's not like being at war, obviously, but it is your emotions take a beating when you're in the hospital, and then in training hospitals where you have a million doctors coming in and everybody giving you their opinion, or you're lost. So the other thing I usually tell them is try and find out who the boss is, and just listen to the boss, because everybody else will be well intentioned, but too much information is just that, too much information. So it is being in the hospital is a horrible experience. That's what I told my patient. I said that's why when you go on vacations you stay in hotels, not hospitals, because it's a horrible place to be. It's a horrible place to be.
So what do you recommend as far as like trying to make the hospital environment easier for both parents and for the baby or the child going through open heart? How do you make it much more like home?
I think one of the most important things that they do now is that prior to anything, they take you through the steps. They'll show you where the baby will be. They'll show you, you know, one of the shocking things is your child comes out with tons of tubes and IVs and machines hooked up. The child will probably be still sedated. So it's really scary. The chest will have a big scar with tape. So if you know that what to expect, the shock is not that great. I think the other thing that would be important is to try and simulate the 24-hour cycle, not have the lights on 24 hours a day, where your circadian rhythm is all thrown out the window, even in babies, even in children, but also in teenagers and the parents, the noise, the people. But, you know, those are things that are very, very hard to control. But allowing the parents to stay with the baby is a big one. Before, I remember when I started training, 9 o'clock, everybody out, you know, and the babies were alone, the parents were not there. So it's important, I think, to have the maternal touch and the parental contact. But there's things in an intensive care unit that just can't really be controlled, because you know, alarms are important. You know, I wish there was a system of like buzzing a beeper or something that the nurse has on the waist, you know, that doesn't wake everybody up, just alerts the nurse. But I guess those are things that they work on.
So as far as like getting a child prepared and telling the parent how long to expect, you told us the great possibility is the likelihood is 4 days. Now, would it be likely that it would be grander? Most likely.
Yeah.
Can you walk us through like what that is? Is it different for every procedure? Is it strictly for open heart that it's 4 days and then possibly more? Is that the only?
Well, there's the challenge of pediatric cardiology is that versus adult cardiology is that in adult cardiology, your patient was born with a normal heart. All the arteries are there, all the chambers are there, all the valves are there. It's just taken a beating after 50, 60 years, and you just need to patch here and there. A child, nothing is guaranteed. The child might be missing an artery, might be missing a valve, might have a big hole like Jack had, with instead of 2 valves between the atrium and ventricle, one big one that has to be fashioned into 2. There's simple defects, which is just a little hole that all you do is patch, and those babies can sometimes go home in 2 days. So it all depends on the lesion. There are very severe lesions where the child is missing actually an entire half of the heart, and those surgeries are more complicated. The babies are younger when you operate on them, so it really depends. It's a lesion specific question. Usually the average is about 4 days, and what makes recovery difficult in adults and in older patients is the ability to worry. When you worry, you really impact your recovery. Babies don't know what the heck is going on. They just know, wow, yesterday was horrible. Thank God today I can go to the playroom. They don't worry. So that really is so helpful in recovery. And I sometimes feel like babies do well despite us.
Right?
The ability to recover, especially trisomy 21 babies, are so tough. They really recover much better than non-trisomy 21 babies.
Really?
In most cases. They're very tough.
What do you think that
I don't know. I don't know. But the recuperative ability of babies in general is tremendous. I mean, and that's one of the, when I decided to do pediatrics, first of all, I remember one teacher, I told him, I don't know if I was an uncle very young. So, and my brothers were like rabbits. They had kids all over the place. So I was a young uncle, and babies know who the younger is. And I really enjoyed their company and stuff. But what really got me is this teacher told me, who would you rather be thrown up on by? An old guy or a baby? So I said, you know what? A baby. Let's do pediatrics. So, and then being in the pediatric residency, where I thought I'd do general pediatrics, and I did my rotation in the cardiac portion, and I saw how they would recover. These babies had their chest open, their hearts ripped up, patched, plugged, and in 2 days they were fine. I was like, wow, I think this is what I want to do.
That's incredible.
Mm-hmm.
I have noticed in our journey with Jack, and I don't know, maybe you've noticed this with your trisomy 21
Mm-hmm.
babes. He's such a hard worker.
Mm-hmm.
There's like an incredible sense of like passion and drive
Mm-hmm.
that I've never seen.
Mm-hmm. I think with trisomy 21, and I went over this, it's stimulation, encouragement, don't stop. OT, PT, encouragement, get him involved. Because, there was a time when, the trisomy 21s weren't even considered for surgery. This is like, why waste the, resources on, because they are wonderful human beings. They are loving, and they're just special. They're very special. And in our, we see tons of trisomy 21s because, like I said, at least half of them will have some form of heart disease. And to see, one of the most rewarding things is to see how parents, initially shocked and feeling that they did something wrong, or why did I get this, and then seeing how they are, it's almost like a gift that they get. So it's a very rewarding thing to see. They're usually kind, they're sensitive, they're driven. So it's what initially was felt to be punishment. Parents realize that it's a gift. So that's very rewarding what I do.
Wow, how beautiful. And I just thought it was us.
Oh, no.
Oh, my goodness. So in talking with, like, what do you suggest for parents to do for themselves during this process of preparing for open heart and getting their kids out of surgery?
You know, I think sharing with people who've been there and done that is very important. There are a lot of support groups of parents that were in the same position, have gone through it, have developed coping skills, or have seen things that we don't see. And those support groups, I think, are super helpful because, you know, if you haven't met the boogeyman looks pretty scary. But once you see the boogeyman, the fear goes away. You know how to deal with him. So I think once you have seen parents that have gone what you've gone through, or what you're going to go through, and realizing that there is hope,
and resilience,
and the most common comment I would get when I would see patients post-op in the office is, "Doc, if I would have known it wasn't that bad, I wouldn't have worried so much." Fear of the unknown is the worst thing. But if you have people you can, talk to that have been through your same experience, they can really do a lot in calming your nerves and knowing exactly what to expect.
How is family support in this process?
Oh, huge, because, from bringing you food or coffee, or if you have other kids at home, they'll take care of them. Or if you have a dog to feed, family can take away a lot of the extra stress that you don't need at the time. Your job at that point is take care of the child that is needing your 100% attention, and family can really take care of all the rest. I mean, pets, other kids, checking the mail, with you guys, it was also an added stress that your care was all the way on the East Coast,
right.
So,
and in North Carolina or Maine.
Right. So we do see a lot of parents where, they might live in Broward and they're being operated in day. They have other kids that need to be taken to school, make their lunch. So a family support system is huge.
What about for the siblings? What do you recommend parents do for the siblings that are processing as well? Because the parents have a lot that they're taking on. And are there support groups? Should they seek out therapy immediately? What do you recommend?
I think so. And they're, older siblings, for example, if you have a teenager, they would probably understand it a little better. But younger siblings, they say, why are mom and dad with Jimmy all the time? And they may start acting out, and it's important for the parents to know that can happen. And I think having somebody, talk to the child, a professional, and explaining to the child in their terms and their level what's going on. It's not that mom and dad are ignoring you. Is that Jimmy needs them right now, same as they would be with you. But also dedicating time to them as well, and understanding that a lot of their behavior might just be acting out, and it's not that they've become brats all of a sudden. It's hard for everybody. In more complicated cases, also you have to consider that you're dedicating a lot of resources, financial, time, emotional, to this child, and sort of the other child might feel left out. So they're all considerations that need to be taken into account, because the tendency is to just drown yourself in the other child, but right. The other children are still living and needing your help. So that's where family comes in, and trying to make time for the child that's not involved in the medical issue.
Do you see a lot of divorce in the cardiac?
Well, unfortunately, there's a lot of divorces, but there's a lot of finger pointing and blaming, and why did you do this, or why it's your fault, or so yeah. But fortunately, that many times is transient, and another rewarding thing is seeing, in pediatrics, you're dealing with, in general with young couples. that haven't really had life experience, haven't really, their main stress is not having Wi-Fi at the Starbucks, So all of a sudden you have a kid that is going to transform their whole life, is rough. But what's beautiful is seeing how they mature as parents, taking care of this child, and their priorities change. But yeah, you do see couples where they become distant and might eventually end up in divorce. Fortunately, that I know of in my years, I don't think any. But yeah, you could see the tension. Or if the parents were already divorced, and the child goes through it, then the blame game gets even worse between the two of them. So, but fortunately, it's not something that I would say was very common.
What do you feel those families who have gone through it, gotten kinder, and have a different sense of respect for like their new reality? Mm-hmm. What do you think makes them much more resilient and brings them through that darkness into the light?
I think realizing that it's not all about them, that all of a sudden this little creature that didn't ask to be brought into the world needs somebody who's going to do it. So I think the transition is realizing that it's not all about them. It's about this little child that needs their help. I think it humbles them, and they realize, if there's no Wi-Fi at the Starbucks, it's okay.
Right. So once they have the child, and like with Jack in our situation, would doing probiotics or with prebiotics, etc., assist the heart? Would that be something that, is there another way to help heal the heart and expedite?
Yeah, I think gut health is huge. Gut health, brain health, mouth, health. I think a big one that people don't understand. Why are the teeth so important? Because if you have gum disease, means that you have bacteria flowing all around your mouth that could, get into your bloodstream and infect. But I think the more we learn, I take probiotics every day as well, because it when you have bad GI flora,
Mm-hmm.
that's why it's bad. You want the correct bacteria that help you digest food well, that don't produce bad, byproducts. So I'm a big proponent of probiotics.
So do you recommend oral probiotics as well, like for the mouth?
Mm-hmm. For the mouth, what we recommend is brushing your teeth for 2 minutes twice a day and flossing. Okay. That's the easiest. Well, not the easiest. Try to get a 2-year-old to brush their teeth. but yeah, that I think developing that as a habit is important.
And I think people forget that their teeth are the closest to like the brain, right? And all that bacteria circulating can go right to the brain. And
if you have, artificial tissue in your heart, like patches or cadaver parts and stuff like that, that can be affected as well. So you don't want I think it's important to give visual examples to patients. And I remember saying, when you look at a waterfall, wherever the rock is smooth, you don't have moss growing there. The moss grows where the rock is rough. So inside your heart, if you have patches or rough parts, that's where bacteria can adhere. If you have a smooth heart, bacteria just flow by. So if you have rough parts where you could have bacterial growth, make sure you brush your teeth really well so that there's no bacteria that can settle there.
That's amazing. I would have never associated that as well. Jack got cavities at one point, and I was so upset because that meant extraction, because it was right between. So that was another trauma we ended up going through, extractions, right? And having to walk him through the emotional aspects, because naturally they want to sedate. And we'll get to sedation soon, because I do want to ask that. So we started water picking immediately, to help with that.
Yeah.
Now, trisomy 21 children tend to breathe out of their mouth unless they have good muscle tone.
Yeah.
What else do you suggest because of that?
Yeah. Well, usually the mouth cavity in trisomy 21s is also a little smaller. That's why when they're babies, they look like they're sticking their tongue out a lot. And you think that the tongue is big, but it's not so much that the tongue is big, that the oral cavity is smaller. And that combined with a low muscle tone kind of collapses airways. So it's important. I think it's very important. One of the things is when they sleep, if they snore, that is something that, before you used to say, oh, how cute, they're snoring. No, when they're snoring, they're not breathing well. So making sure that their tonsils, their adenoids are not part of the problem. Sometimes they might even need CPAP at night, because if you're not breathing well, your lungs can get sick. And in a child that already has heart disease, the lungs, you can't afford to have your lungs get sick. With a water pick, it kind of made me think about my kids. I remember the mirror in the bathroom will always look like somebody had sprayed it with a shower. But anyway,
right.
You got to teach them how to clean the mirror after they use the water pick too. Children with Downs will have an extra issue because their mouth cavity is smaller, and everything might tend to collapse a little bit easier, making breathing a little harder.
I have found that he has taught us so much, especially like with the obstructive sleep apnea that children with Down syndrome are prone to. Adults as they age 35 and up, they get prone to obstructive sleep apnea and central sleep apnea, which is different, where the brain is actually shutting off, right? Not communicating to the rest of the body to say, breathe.
Yeah.
That's kind of important.
Because what happens is sometimes if you're not breathing well, your levels of carbon dioxide are, let me put this right. The levels of carbon dioxide are increased. So it reminds me of the joke of the dog that barks every time he sees something going on, and he's always told to be quiet, and then somebody's stealing the guy's car, and the dog said, well, I won't bark anymore. So when the brain is telling you the CO2 is high, well, you're not listening. Well, I don't care anymore. So then that becomes central. But yes, I've been using a CPAP for the last maybe 6 years because I snored like a beast. I never understood why none of my kids wanted to stay in mom and dad's room on holidays. And I remember telling my wife, I can sleep 10 hours. And I still feel beat the next day. So I had a sleep test. My oxygen saturation dropped, and I had apnea. I don't know how. And since I've been using the CPAP, I feel, as you get older, you don't never feel great, but as great as you can feel at 65 with a CPAP machine. So yeah, it's important, because with kids, what happens, and unfortunately, we're seeing it with the obese population of children has just exploded. And a lot of these kids snore, have obstructive sleep apnea. Nobody pays attention to it. So what happens is that the next day at school, they're sleepy, they're tired, they don't learn, their grades suffer, then their self-image suffer. It's really a cascade of stuff that could be so easily taken care of.
And there's early hypertension.
Early hypertension, heart disease, absolutely. Even
diabetes.
Yeah, absolutely. Metabolic syndrome. It's
now
it's
would
important.
Fatty liver, like non-fatty liver disease, happen because of that as well?
I'm not sure. Usually, the fatty liver we see in the kids that are so obese that the body says, "Well, we ran out of areas to put the fat. Let's do the liver now."
Right.
Yeah. So it's fatty liver is a concern, because if it's not taken care of, it can lead to hepatic cancer and liver issues. So yeah, I had to learn a lot of adult cardiology because of the obesity epidemic in kids.
Wow.
I've never had to deal with high cholesterol or diabetic kids, or in my training, and now every kid that comes in is overweight.
Now nutrition is such an impact, huh?
Nutrition and activity. All kids are glued to their electronics. think they played tennis. No, you played, your video game. You didn't. You just moved a finger.
Well, we've got the Wii at home, so right.
Yeah.
So there's a little
activity.
A little activity, right?
Right.
So let's go back to sedation and what that causes for the body, and what do parents do? Does that affect the brain? Does that affect the blood? How does that long term affect the child's development, and neurologically, how does it affect?
Well, it acutely, especially in kids with obstructive issues of the mouth. Keep turning this around. It's important with sedation to keep an eye on the O2 on the oxygen saturation, because with sedation, again, you're sleeping and you're sleeping very deeply, and you're relaxing your muscles tremendously. So minor obstruction can become significant obstruction, and acutely can lead to even cardiovascular arrest. Long term, I'm not sure that sedation alone is an issue. Cardiopulmonary bypass is, because what cardiopulmonary bypass means is that when you're operating inside the heart, you can't have a beating heart where blood is flowing. You need a clean field so you can see what you're doing, and you can't have the heart moving because you're stitching and you're patching. So a big part of open heart surgery is that the heart is given a solution that stops the heart, basically, and you have catheters placed that take the blood that's going to go into the heart, bypasses the heart, goes into a heart-lung machine that oxygenates it, and then delivers it back to the body. Because you're not getting the normal circulation, the other part of cardiopulmonary bypass is that you try to cool down the brain and the body. And literally, when children go for open heart surgery, their head is in a bucket of ice, and around the heart there's ice. And the cardiopulmonary bypass machine also cools the blood down to slow down the metabolism, so that you don't need as much oxygen for your chemical reactions of your body. So even though those precautions are taken, there still could be some damage. So kids, for example, that need 3 or 4 surgeries throughout their life, if in addition they had the type of defect that during fetal life compromised brain circulation, that's a growing field in cardiology, neurocardiology, to see how those insults can be minimized so that the child can develop more normally.
I guess my question as a practitioner, I do biofeedback, and the craze this day, I want to say, is like detoxification. Let me go ahead and do a parasite cleanse. Let me do a heavy metal cleanse, that kind of thing. And, sometimes I think, and we've been down this road on a personal level, trying to cleanse ourselves so that we, as caretakers, can live longer, because that's one of our concerns. We don't want to not live long enough because of stress. Stress can kill you, literally.
Absolutely.
Right? Can create heart attacks, high blood pressure, all that kind of stuff. What do you recommend as far as like detoxification? Does the sedation or any of the medications that he's on for open heart prior affect and provide heavy metals to the body? 'Cause you said that they were toxic. So what do we do to detox a child after?
Oh, most of the medications that we use have a pretty good long track record, and it's a risk benefit. Many times the parents would tell me, "Well, what's the risk of taking this medication? I've read this." Well, probably what you should look at, from my point of view as being the physician, what's the risk of not taking it? And everything in life is an assessment of risk versus reward. And if not taking a medication will limit your life, then
right. And I am not saying not to take it. However, I know one of the concerns I had as a parent early on was, would the sedation create heavy metals that his brain may not process, and therefore learning would be slower?
Yeah. I don't think so, because you're not, and again, this is a total non-expert opining here, which I do very well, actually. My wife says that that being a subspecialist, my wife says that I start knowing more and more about less and less until I know everything about nothing. So the fact is, with sedation, I don't think you're introducing heavy metals. They would have to come from somewhere else. So in that aspect, there are some, for example, if you have intractable arrhythmias, heart rhythm problems that don't respond to anything, and that's more of an adult issue. You do see it in pediatrics, but it's more. There are some medications that can be kind of toxic, for the thyroid, for the liver. But then again, it's
you gotta outweigh your risks.
Exactly,
right?
exactly. And I'm not too familiar with detoxification or, but again, if there's evidence that it works, I'm all for it.
Right. It's one of the reasons why I got into biofeedback.
Mm-hmm.
Because Jack became an insomniac, and we
kind
of needed sleep.
Mm-hmm.
And you can't give a 3-year-old or a 4-year-old sleep meds.
Right.
So we had to find a solution, and biofeedback provided like that retraining of his brain and his nervous system to help calm it so he could establish a rhythm and homeostasis, right?
Because when Jack is an insomniac, mom and dad are
become
insomniacs.
The inflammation was insane. I looked like I was wearing red mascara and eyeshadow at all times in different places. It was unreal, and it really made me emotionally dysregulated.
Oh my gosh, it's that's why it's a form of torture.
It is. It's like water torture.
Sleep deprivation.
And with him, he was like, man, I slept for like an hour. We're up.
Oh my gosh, no.
So what do you recommend? Is that typical of open heart children or not?
Maybe initially, it like you say, it might be a form of PTSD. Because the first thing you notice is every time they go to any doctor, they panic because they associate, they have flashbacks of their hospitalization, the being stuck, the being, sutures removed. So a lot for the first 6 or maybe 8 months after surgery or a traumatic hospitalization, kids might have a lot of nightmares. They might fear going to sleep, and then that affects their sleep pattern. Absolutely. Beyond that, I'm not sure. I'm not sure. I don't think it's a typical post-operative complaint. After the initial, stress is over, which might last up to 6 months, more or less.
Okay, and longer for the parents.
And long. Oh, absolutely, because you're always worried. Any little thing you see, is this the beginning of something? It's hard to shake the paranoia. It's very hard, and that's where initially when I said our ability to worry is what messes up everything. Kids don't worry; they don't associate one thing with the other, and they just live their life happily. But we as parents, we are always thinking, well, if it happened that time, can it? Is this related to it, or it's sort of like the damaged goods feeling that it's not perfectly normal. So I wonder if it's going to continue to give us a problem. So that's more of a parental or an older adolescent issue. Older adolescents, their recovery is a little harder because again, their ability to worry and to kind of catastrophize, things.
So can you think of anything that we may not have touched on for as someone who is expecting or someone who just got acquainted with the diagnosis and has been delivered?
My main recommendation always to parents were to don't make the child an emotional cripple. You know, no, don't do this, don't do that. The child is fixed or repaired. Children are the best judges of how much they can do. Once the testosterone kicks in during adolescence, then it's a little different. But if a child does this and it hurts, they won't do it. But if an adolescent does something that hurts, but they're down by 2 points and there's 4 seconds, they'll push, and that's where trouble starts. With kids that have been repaired, they're repaired. Treat them like any other child. Put the boundaries you would put on any other child. Expect things from them that you would expect from any other child. The other thing is it's nobody's business what they went through, because you don't want other kids' parents to say, oh no, don't bring Jimmy over because he has a heart condition and I don't want to deal with this. And so you don't want other parents to look at them differently either. What they went through is your business, the child's business, nobody else's business. Because kids can be pretty cruel, and sometimes parents can be pretty cruel as well. No, don't ask him over because we're having a pool party, and what if something happens? No, don't ask. So that is also, I think, important.
What about like right after surgery, especially like picking up babes right afterwards? We're not supposed to elevate their arms, right? For how long is that? And are there things that we may not remember to share?
Yeah, that's usually, and in Jack's case, when they went into his chest, his sternum was still pretty much cartilage. It's not really bone. And they do tie the sternum down with stainless steel ties. But the sternum is a bone. Same way if you fracture a bone, you have a cast on for 6 weeks. That's usually what it takes for the bone to heal. That's usually the time frame that we recommend not protecting the sternum, because it's a broken bone that needs to heal. The other important thing is actually immunizations. Sometimes kids will get blood products during surgery or after surgery, and it's not that it's dangerous, but if the blood products they receive are from people that had immunizations already and have the antibodies, you might give an immunization, think the child is protected, but the blood he received neutralize that immunization. So, give him the MMR and it won't work because the blood he received kind of cancel that. So there's, and right now I don't remember the time frame, but I think it's about 6 months or 8 months after surgery, maybe up to a year, that you kind of pause the immunizations, the ones that are, subject to being neutralized by blood product antibodies. But that's something that the pediatrician would be very familiar with. So that's something that you don't automatically think of either.
No, and I don't think some of the pediatricians do address that.
Yeah.
I don't think we were told that at all.
Okay.
So I'm glad that you did mention that, because I think that's highly important.
Yeah. Usually in my letter, because now with electronic medical records and stuff, and the repetitive nature of the reports, you typically have templates that you kind of fill in, and the post-op template, I usually gave instructions to the pediatricians on how to follow that. But again, pediatricians are busy people, and sometimes they don't have the time. They see 70 kids a day, and then they have a pile of paperwork that they need to look at the end of the day. So if it, it's I think that's another reason why I didn't do general pediatrics, because it's a volume practice. Yeah.
So interestingly, I was told that, and I don't know if this is true, and I was hoping that you might let me know, when the open heart is being done, and I don't know if this is done strictly with trisomy or with all children, the thymus gland is taken out. Is that typical?
Well, the thymus eventually kind of disappears. It becomes a non-issue. The thymus is kind of lies on top of the heart like a blanket. They might remove it just for exposure of the structures better. I'm not quite sure. Probably somebody like a Redmond
Dr. Burke.
yeah, would be able to answer that better. I don't know if they. I know that it becomes a non-issue, and sometimes actually the thymus might, if you take an X-ray of a baby, the thymus is blanketing the heart and may give you a false impression that the heart is big and it's just thymus. But whether they take it out or not, I'm trying to think. Yeah, they might because in looking at X-rays after surgery, I don't recall seeing a lot of thymuses. But
Interesting.
yeah, so yeah, I never thought of it. It's a fairly unimportant organ.
Really? Because I thought
yeah.
it regulated the immune system.
It goes away after a while. So
Right.
yeah.
Okay.
So I might be wrong again with that one, but
Well, I want to say thank you.
oh,
You honored me. I
Oh,
reached
gosh.
out of the blue
mm-hmm.
and just said, I want to make a difference and help additional needs families come together and learn what I wish I had known at that
Yeah.
time. Right.
Yeah.
And I wanted to take my tragedy, and what I was feeling was a tragedy,
Right.
like you mentioned, and transform that and transmute that energy and provide, your vulnerability becomes your strength.
Absolutely.
And so thank you for
Oh, you're quite welcome.
accepting my invitation. How can someone get a hold of you? Because now you're retired
Mm-hmm.
and you're working in, is
The
it Bimini?
No, in the Virgin Islands.
Okay.
St. Thomas and St. Croix. I go there every 10 to 12 weeks. Yeah, it's I grew up in Puerto Rico, and I used to go to the islands a lot. A lot of people, for example, oh, we're going to Hawaii. I say, you don't need to go to Hawaii. The most beautiful beaches are the U.S. Virgin Islands or the British Virgin Islands. You don't need to. So I've always loved that area. And even though it's an American territory, they have nothing there. It's a third world area.
Oh.
They might have more in the form of subspecialties for adults, but for kids, there's nothing there, and it's because the population is not large enough that you could survive as a subspecialist in the island. So it's sort of catch-22. If you were to live there, you wouldn't have enough of a population to pay your bills. So a lot of the pediatric subspecialties go there every once in a while. So that's what I do. It started in the COVID era where I was like, well, what can I do that kind of gets me out of this isolation? And they reached out to me, and I go there. I work out of the government hospital
Mm-hmm.
in St. Thomas, and in St. Croix I go as well.
Well, beautiful. Can anyone reach out to you? Is there
Sure.
on
Sure.
Instagram, Facebook?
I'm on
or
Facebook
Okay.
under my name.
Robert Lowell.
Lowell, yeah,
Yeah.
VOGT-Lowell. You'll question whether my kids are mine because they're handsome kids. But the mom is very pretty, so I guess I can claim that.
Fair
Yeah.
enough.
Yeah. So yeah, and I love answering questions, and if you have any questions, just drop me a on Facebook. If you have any issues that I could probably help with.
Okay. Thank you very much.
Oh,
I
this has been a
appreciate this.
treat. This has been a treat.
Likewise.
Thank you.
And maybe we'll do it again to answer some other questions that come up.
Sounds good to me.
All right. Thank you.
All righty.
Healing doesn't belong to one person. It belongs to all of us. It lives in how we care for ourselves and how we show up for each other. Thank you for joining us on Down to Heal, a space where we don't escape the mess. We meet it with heart, with courage, with curiosity. This podcast is part of a bigger movement, of remembering that healing is relational, that community is sacred medicine, and that we rise by tending to the roots. And that real change begins by tending to what's been ignored for too long. Through Synchronicity and Additional Needs Incorporated, I walk alongside parents, practitioners, and families navigating the spaces where the system falls short and where the soul steps in. If something in this episode spoke to you, let it ripple, share it, sit with it, or simply take a breath. And remember, you're not alone, because this is not just personal. It's collective, it's cultural, it's generational. It's how we build a world that holds all of us. Until next time, stay rooted in truth, stay soft in your heart, and stay down to heal.